see you and I'll get the intravenous injections, chemotherapy.
Yeah. And you can plan for it to take pretty much all day that day. Okay? Because when you get the rituximab for the first time, it has to be given very slowly. In fact, the rituximab can sometimes take up to 8 hours to give the first time. And that's because people have a little reaction to it while it's being infused. Okay? That gets much better all the subsequent times. And in fact, sometimes we can give it quite rapidly in only 30 to 60 minutes on subsequent times. But the first time we go real slow. Okay? And you may have little shakes, little reaction. But that's the only real side effect from that medication.
Good.
Okay? The F and the C, however, are chemo. And they're going to suppress your blood counts. And they're the ones that will probably make your hair fall out. Okay? The suppression of the blood counts is something we'll have to keep a close eye on. Okay? The red cells will go down, and that will probably cause you to have a bit more fatigue than usual. It's kind of expected while you're on chemo. But if it gets too low, we occasionally have to give someone a red cell transfusion. It's not that common on this chemotherapy, but we do see it now and then. And the platelets can also go down from this, and we sometimes have to give someone an infusion of platelets. Okay. The big one though is the white cells. Okay. The white cells, the bad white cells, which make up a very large degree of your current white cells, those will go down. Those will go away. That's what we want. But also the good white cells go down too. Okay.
Yeah.
The neutrophils being the main one that we keep an eye on. Okay. And so while you're on chemotherapy, you have to assume the whole time you're on chemotherapy that you're what we call neutropenic. Okay? Meaning that you have a low count of neutrophils in your peripheral blood, which makes you at increased risk of having infections. Okay? What that means is that any time from the time that you start chemotherapy until you're completely recovered from the last cycle of chemotherapy, if you have a fever, you have to go to an emergency room, no questions asked. Okay? And we consider a fever anything 100.2 or higher. All right? If you get that, you have to go to an emergency room and be evaluated, and they have to give you IV antibiotics right away. And that's because if you have a neutropenic fever, in other words, a fever while your neutrophils are low, it can turn into a life-threatening infection quickly unless you get on IV antibiotics. Okay? So if you go to any competent emergency room, they know how to deal with the situation. You can come here if you want, but you don't want to risk it waiting or delaying, or you don't want to wait it out. You have to go, if it happens at 3 a.m., you have to go to the emergency room right away.
If I take my temperature and it's 101, I'll go to the ER or here.
If it's 100.2, 100.4, you got to go in. If it's 100, hasn't gotten up there yet, then check it again in another couple hours and see if it went up or down. All right? They tend to spike. They go up and then they come back down. But if you catch a temperature 100.2 or higher, or if you're just not feeling well, you have to be evaluated. Okay? Most people get through this without that happening, without having a neutropenic fever, but it's also fairly common to happen. So don't risk it. We give you IV antibiotics until your counts recover, and it's all very routine. Okay, but then it keeps you from getting a septic, right? Which you need septic shock the day later if you wait. So we don't risk it. Okay. And obviously the chemo can also cause some nausea, all right? While you're getting the chemo infusions, the nausea is very well controlled. If you get nausea after you go home, when you, between cycles, if you get some nausea, we'll give you some pills that you can take that will generally control it very well.
Namely?
So there's two different ones that we'll give you.
Hi, Paula.
One is called ondansetron.
Yeah.
Which is also called Zofran.
Yeah.
That's the one that you take if you've recently gotten the chemo. Within 2 or 3 days, got the chemo.
Yeah.
Okay? After that, you want to take a different one called Composite,
Yeah.
okay? Which will control the delayed effect potential nausea from the chemo. Okay, we're going to put him on FCR
Okay.
starting in December. He's got a hernia surgery next month. We're going to get through that. And then we're going to put him on FCR starting December 10th.
Okay.
December 7th, sorry, December 7th, which is when you come back to see me. Okay? Any questions?
Well, the antiviral stuff is also a good idea.
Yeah, that's already prescribed.
Good.
I'll prescribe the nausea pills for you when you come next time.
Good.
Okay?
All I can say once again is that it's really great that these ballooning, swelling lymph nodes on my shoulder and ear are going to be reduced.
Yeah.
It's a big windfall. So I'm very happy about that.